So we are live now on this channel on Biomathematics. I'm glad to present my friend and the colleague of class. Just a minute, let me just. So I'm glad to present him with some discussion about the best way to make this talk. So this talk will be available after all. Jude is going to present for you some kind of slide of his presentations, and he allowed me to stop him to make some comments. And Jude, please, Jude, correct me if I'm wrong, but Jude is a professor at the University of York University. He did his postdoc at Princeton University, and his PhD at the United States. I invite him not just because he's my friend, but because he also is a very competent professional, and it gives me great pleasure and honor to have him here. So, Jude, I will allow you to start to say anything you want.
Thank you so much, George, and thank you for this opportunity to be part of your channel. George forgot to mention that we have the same supervisor for our master's degree. That was Professor Pasquale Palumbo, and that's where we get to know each other. I'll be glad to share what we do at York University in Toronto, Canada, with you. Josh, can I go ahead and share my screen, please?
Yep, for sure. You have to share, and I'll give you permission.
Yeah, thank you. Though I'll be sharing my screen, this will be some sort of a conversation where you will be able to ask questions on what you see here or what your worries when it comes to mathematical modeling. What do we do with it? Or even if you don't know what mathematical modeling is. And the questions are mostly based towards what can we do with the mathematics that we learn in high school? Is it useful? Does it inform policies? That's what I do every day. That's part of my work, and I'll be happy to have that conversation with you and the general public, and it will help a lot of other people. I will start first by just going over a project I just finished. And I find this work very interesting. Why? Because it's looking at pre-existing country characteristics. You may ask, why pre-existing country characteristics such as social, economic, environmental factors influencing the spread of COVID-19? We are concerned when COVID started with a couple of friends. There's Ekwa here, who's based at Princeton, and then there's Sarah Bono at the Smithsonian in DC, Environmental Research Center, and then there's me here. When COVID just started, and we were recording a number of cases. This is as of a month ago in the fall. We had, I think there are almost 8 cases now, and then we almost have 2-something million deaths already at the moment. In Canada, at that more than a month ago, we had 330,000 cases, but I think we have almost close to 800 right now, and 600 right now, and then the number of deaths have gone up to close to 15,000. And in Ontario, our province here. So what happened with Ed and Sarah when COVID started was, within the first few weeks, we were just like most modelers would do, where when something is happening and you don't yet know the mechanism, what is driving that, the first thing is to play with the data that is available to you to look at the shape that that data is taking. So within the first few weeks of COVID starting, Ed and I, we just met, and I think earlier on in March, when in Toronto, Canada, we were asked to work from home. So Ed and I began looking at different countries, starting with Canada, of course. We look at the case of China and South Korea at that point, and we were wondering, we just scattered the diagram, because normally before that time, before the public health intervention policies, what we call the non-pharmaceutical interventions, there were no control measures. Nobody knew anything about the characteristics of COVID-19. And so what we did was that we started asking ourselves, what are the pre-existing country characteristics that may have caused different countries to take different shape? Once we scattered the diagram and that phase, we looked at that particular phase, then we moved to the next phase of the disease when actually non-pharmaceutical intervention had been applied, and we started asking questions. which of these non-pharmaceutical interventions were more efficient or effective in bringing down this? And then once at this stage now, when we had these, and I started moving on to we started having our second wave, we now move to the question of which of the non-pharmaceutical interventions actually that were lifted actually caused this second rise, or did people really get tired? And we started looking at human behavior, bringing in human behavior into the modeling from a process-based perspective, taking into account human dynamics. People will get tired. They need incentives to be home. People will not respect social distancing. Some will. And we take that into account and we want to find out if you bring in human dynamics into the situation, what is causing the second one? And at this point now, we are at the point where we're looking into vaccines. What role is the vaccine playing? And how long will it take, given the way people are behaving here in Canada, in Ontario, in Toronto? How long will it take for us to hit the herd immunity in Canada and the whole world? So we're looking into that right now in different perspectives. I will not be able to share completely all our research, but I will come here from time to time to share the different research that we did at different phases. Today, I will start with the first phase of this research, which was looking at this point, there was nothing put in place by our government that slowed this down. What did slow this down will have been the pre-existing country characteristics. And so we play with that before we started looking at other models when the government had put in place control measures, when people have started being aware of the virus and social distancing, and when the vaccine come in. So we have a lot of research around this area and at different phases. So there's a fourth phase that I didn't add here, which is what we are looking at now, vaccine and the second strain. What about the South African strain? What about the UK strain, the mutant strain? When it comes here, what will happen? What's the dynamic? When is it gonna take over? What is the race between our vaccine rollout and the speed at which the other strain is taking over? Are we going to be able to win the race by ensuring that we hit the herd immunity before it completely take over in the province? Or what if it take over? Are we still going to have our herd immunity by fall or by September as was agreed? So those are some of the questions that we are now asking ourselves at this point. So again, I want to repeat again, our work has started with the first phase of the virus, which is basically when it come into a country and you start getting few cases, the dynamics that it will take. What is driving that particular dynamics? What are some pre-existing country characteristics that are actually driving that? That is what we did at this first phase. Once that happened and they introduced non-pharmaceutical intervention and people start social distancing, being aware of the virus, then we start asking the questions, which non-pharmaceutical interventions actually help to slow down this growth, to ensure that we do not overwhelm our hospital systems? And then we start bringing in people's behavior, the dynamics of human behavior, social dynamics. I remember reaching out to my friend Josh and we discussed about these social dynamics when you bring out human interaction. Some people are against lockdown, some people are against a lot of social distance measures. How would that play a role in driving future subsequent outbreak? With this, I think I spoke with my friend Josh at this point when we were around this area. So when we took into account all of that and we're studying, we're now in the fourth phase of it, which I will come here to share with you. So I will start by discussing what we looked at in the first phase here, which is if we were plotting data for different countries, but I just want to pick two of these countries and show you. We started with Canada, just scattering the data at that point, South Korea, China, and other countries. If you look at Canada in this earlier phase, it was quite steep. If you look at Chile here, Chile went really slow before they went up here. And the question you should have asked is that, are they really good at social distancing, or are there some pre-existing country characteristics that actually help Chile not to go this fast or not to overwhelm their hospital system? Because the goal was, if we start going really fast, then we end up overwhelming our hospital systems. What is the best? If we go slowly, then we're able to take care of everyone in the hospital, and the hospital beds, the nurses will not overwhelm them, and we'll be able to handle this before we get a vaccine. So what are those pre-existing country characteristics? So we, on our own, hypothesize that demographic, social, environmental factors are associated with this initial growth of the pandemic. That was our hypothesis, because this is different across countries. But again, we did take into account
the fact that if you are in a particular region, the fact that you are in Brazil, the fact that you are in Canada, the fact that you are in South Korea, have a role to play because of the country, and that the number of the time you started recording your cases from when China recorded their number 30 case equally have a role to play. So we did account for those coverage. Now we once we account for all of that, we now took all those coverage and we decided to say, okay, how can we analyze this? We tried different. We pick all the coverage that you could think of when it comes to demographic, social, environmental coverage. We pick almost all what you could imagine. In the demographic variables, here I will list the ones that we had actually, after performing the variance inflation factor analysis, show that we remove collinearity, we were left with. So these are the coverage we were left with after we had a lot of them. So in demographic variable, we had population ages between 20 and 35. People were talking about young population, which I'll be referring here as youth. Total population. People said the total population have a role to play. For disease category, we look at mortality rate from lower respiratory infectious disease. How many people die from respiratory disease in a particular country? Does that have a role to play every year? So we looked into that and we used recent data, most of the time ranging between 2010 and 2020 for those coverage average. Mortality rate from infectious and parasitic disease. How many people in one particular location die from infectious and parasitic diseases every year? Does that have a role? Did that have something to say in the initial dynamics of COVID in that particular country? So we looked into that. Now we look at economy. Well, does income inequality have a role to play? Gini, what we call Gini index, does it have a role to play? Is the ease of doing business, does the ease of doing business in a particular country equally have a role to play? If you were in a country where it's easier to do business, does the fact that there are NGOs there that could have informed people about the dangers of the disease have a role to play? So we put this, and they were much more coverage than this, I may say, and that we eliminated them because we used variant inflation factors to ensure that there was no collinearity, and so by so doing, we eliminated some of the coverage. Environmental, we looked at temperature. A lot of work had been done there on temperature because the initial group was between January and March. So we look at that first phase of temperature. We look at precipitation. Then we look at air pollution. Toxic environment. There were a lot of work talking about the aerosols moving on air. Does the fact that the environment is very polluted have a role to play in the initial phase of the dynamics? We look at social variables, the average use of social media to organize action. Does the fact that people in a particular country are good at using social media have a role to play with it? Is it a negative role or a positive role? Because social media could be very useful at informing people, as well as could be very dangerous at spreading dis or misinformation. So we thought about that. What about countries where the government prevent people from using the internet filtering, like in North Korea? Would that play a role? What about a place where people travel to a lot? Does that play a role? Or people in a particular area traveling in and out, does that have a role to play? If you remember in New York earlier, a lot of people go to New York, and a lot of cases were really bad in New York, those earlier phases. So when we had all these variables, what we needed to explain with those variables, which is the initial spread, but we used the basic reproduction number. Why? Because the basic reproduction number tells you if you put in one infected, if you put in patient 0 in a community, how many cases are we going to get as a result of that patient 0 coming into that particular community? And so we use the basic reproduction number. In order to get the basic reproduction number from this explanation, this crude, we use the fact that this is a group rate here that we have to measure. This R here stands for the group rate. And then T here is the serial interval, which is the time delay between symptom onset of a primary case and then their secondary cases. and R is the initial growth rate, which is the initial growth rate that we measure. In order to measure the initial growth rate, we use an equation called the logistic growth model, which is just simple tools that we acquire from high school. Nothing complex here. So all the tools here, you could easily use linear model, but linear model, you could think of this as equation of a straight line, just to measure the initial first group. Once you measure this R, which is gotten from that initial first group, but here we use a logistic model because we assume that the cases will at some point plateau. So we use a logistic group in here. And the intrinsic group here is the average. So, and we are motivated to use logistic group because authors like Ma and all have actually compared different models, and logistic groups performed better. But the point I'm trying to push here is that the tools we use here are basic tools that we acquire from high school. You could think of this as a question of a straight line. Just move it up and just measuring the initial group there, where you pick 2 points there. You just scatter the point and you try to measure a question of straight line. You measure this initial group, and then you put here and you calculate how many person one infected person can infect. So basic tools acquired from high school or from junior high, depending on where, what is done. So we started by measuring this initial growth rate, where we went to each country. I'm just showing here 8 of those countries, but we did it for almost all the countries in the world that we had data for. So we measure the initial growth rate for different countries. If you look at South Korea here, my friends, this is, it went really straight. And when you look at the case of Canada, Canada is not, okay, my country is not here. Okay, Canada is here. Almost straight here, but not as much as Chile. When you look at the case of Brazil, Brazil was not as fast as steep as we have South Korea and Canada. Brazil went slow here, but started going up here. Look at India, almost the same. China, almost the same. Wow, it seems like countries that started going up really fast ended up suppressing their distinct earlier. Well, that's another hypothesis to look into. But it's the correlation. So after measuring that, we calculated R0 for the countries that we have data for. And this is the range of the R0 that we calculated. By R0 here, again, I want to repeat that we are talking about if you send in patient 0 in a community, how many cases are we going to have as a result of that patient 0 coming into that community? That's what I mean by R0. How many cases, secondary cases, are we going to have as a result of that primary case, assuming that everybody there was susceptible? By that I mean that nobody had immunity. Your system was naive to that. So we were able to calculate these R0, the number of persons that one infected person in a community in each country could have affected. And the highest R0, we had R0 between 1.1 and 3.52, with the highest being in South Korea and lowest being in Ghana. Now, we now move on to try to analyze it. I must say that we first of all used just a multi-variable linear regression, and then we went on to use a random forest regression, and we used a generalized additive model. Random forest regression and generalized additive model got almost similar results. So, but we ended up going with generalized additive model that we use here, just to remind you of the form of a generalized additive model, just like kind of an equation of a linear straight line where you have y equals to mx plus c, where c is the intercept. So here it's like beta, and then you have this, but the difference is that the x there are functions, because it could be linear and non-linear. And then we have an error term here accounting for that. So you could think of this model as just equation of a straight line, but in a generalized way. That's why generalized additive. Instead of having x, which is the cover of the input, now it's a function of that. And this is able to capture the non-dynamic, non-linear relationship that could exist between the input variables and the output variables. Once that was done, we took into account what are the random variables that that equally influences. We look at region. The fact that you are from Canada had a role to play. The fact that the total number of cases that when you reach your 30th case from when China had their number 30th case had a role to play. We equally use gross domestic product per capita, GDP of a country, as something that had a role to play, but a random effect. and then we equally look at the underreported percentage as having a role to play. We account for some of the things that may have play a role that could be the same across region. Or if you have countries, we took GDP as a random, which means that it's not specific to one particular country. Countries with the same GDP, you could think of a session of Norway and Finland. Or you think of Brazil and South Africa, or so somewhere, or Brazil and Canada. If they do, GDP is different. Once we did that, here on the horizontal axis here, we have all those our cover rates. And on the vertical axis, we have the basic reproduction number. Again, I would like to remind the general public that the cover rate here are just the inputs, which if you think of at any instance, you look at this, one of these plot here, think of it as an equation of a straight line y equals to mx plus c that we learned in junior high school, and where x is the input and y here is my basic reproduction number. Now we use a model that captures nonlinearity. I will focus more on the ones that we had a p-value, which is almost significant, and I'll focus on these 4. So we found out that the number of young people with ages between 20 and 35, the Gini index, income inequality, let me think of a way, the number of people living in cities, and the use of social media to organize action had a role to play. But the nonlinearity that existed between these 3 caught our attention. And the fact that social media instead had a negative role, those caught our attention really well. By the way, I must say that the explained deviance by our model was 75-point-something%, which is pretty good. When we look at the youth here, what this tells us is that if you have a country with less young people, the number of cases of COVID could be high. But that a country with intermediate number of young people will have the highest. And then as the number of young people increased in a country, the number of cases were lower. This is different from saying that a country with many young people had the lower number of cases. No, it's a very non-linear relationship with intermediate number of young people playing a role. Same as with Gini inequality here. Now, one question could be, why is it that when you have an intermediate level of youth, you play a role, and the lowest number of youth do not play a role? Well, most young people so far, and I don't take me for this, but this is just my interpretation. Most young people so far have been asymptomatic, and so it's difficult they don't report their cases. One additional thing is that people that have died a lot, or the spread rate, is mostly among the older population, those who go to the hospital because of a weaker immune system. And so with a country with fewer young people, you end up having more cases because you have severe cases that tend to count, they report, they're detected. With intermediate youths, yes, you have more. But as the youth population dominating the country, or you have a higher youth population, the cases go down. It could be because these are not being reported. They're mostly asymptomatic. They have a strong immune system that's able to still fight that. That could be a reason. Now, we look at Gini inequality here. And we found almost the same relationship where a country with lower Gini inequality had the lowest number of cases. So which means that if you have a country where the difference between income inequality is low, the cases were lower. But if you have a country with intermediate Gini inequality, the cases were higher. And then as the inequality grew, the cases went lower. And if you look at country's profile, this match almost what we find in country profile, as I'll be showing in the next slides. Here we equally got a nonlinear concave relationship where if more people live in, if the fewer people live, if you have cities with fewer people living there, you have fewer cases, yes, because they're able to distance from each other. They don't bump into each other. When you say people should not move out, others will see others not moving out, but you have a lot of people that are people who will not respect laws, and people tend to copy from those ones, and or people get in touch with each other, breeding around each other. If the city is crowded, that leads to a lot of cases. So there's a lot of reasons that we can account for this, and we wrote a lot about this in the manuscript. The most surprising thing, my friends, is social media, use of social media. It was interesting to find that social media is play a negative role. And we tend to attribute this to me, maybe in the start. I was in a lot of social media groups, and where most of the information was just this or misinformation about COVID. People lying about, COVID does not attack people in tropical area. People who have had malaria infection, or those saying that you could use the different types of medication, or saying that this is a hoax, or the Gates Foundation just created this. Don't listen to this. This doesn't exist, or it cannot attack this and these people from this area. So there were a lot of misinformation. And I must say that from what I saw in my social media accounts, and I'm one person that is not in conspiracy theory social media, but if I happen to have seen that in most of the social media I belong to, then you know how viral that was spreading. I must say that most of the information was this or misinformation, something to say it's a hoax. It's not real. More we are like, this can cure it, from different sources. So we think that social media at the start play a negative role, but we do hope that once the vaccines are available, social media will play a positive role. But at the onset of COVID-19, social media play a very, very negative role. So again, this is a strength on social media that I was trying to explain earlier on about the negative role that social media played in the spread of COVID-19. And I am not here saying that social media is evil. No. But I'm trying to point out that it does spread negative information, but we hope that when there is something like this vaccine now, it will play a positive role. I know it's still playing a negative role with vaccine, but this has not been tested. But we hope that this current time will play a positive role. And then these are the other ones where I have the youth population. And this is where you have the gender inequality, which I already explained, the role that each of these were playing. Then the last one here, which is what I explained, is the number of people in the city. One thing was this point here where the intermediate level of people in the city led to the lowest R0 value. This is what we have not been able to explain. Why would the intermediate level of younger people in the city lead to the lowest R0 value? We have not been able to explain that from a logical perspective. Now, looking at country's profile, it matches exactly what our results got. If you think of Ghana, that had lower number of cases, you will realize that the number of people, if you were just to pick Ghana randomly here, it had a higher number of young people. This is a country profile. The number of people living in the city of Ghana is extremely small, somewhere here. This city here. And so this matches exactly, a country profile matches exactly what we have. If you look at the social media, use of social media in Ghana is extremely low. It's here. And the gender inequality in Ghana is very high. So this country profile portrays exactly what our result is giving. And if you look at the case of Canada here, you have that youth population is extremely low. People living in the city extremely higher, later on compared to the general population in Canada. So the use of social media, surprisingly not as low, as high as other places, but somewhere the middle level, but higher than other countries here. And then gender inequality is very low in Canada. And you can think of this and bring in countries like, I think this was India that was showing, Canada is should have a high use of social media. Yeah. If you think of this, every country profile that we picked ended up matching exactly what our result was giving. So we just pick a few here: United States, high use of social media. United States gender inequality is high in the US. Youth population extremely low, and people living in the city high. And so it matches exactly the country profiles that we have here. So the conclusion is that I want to say that our country, our analysis here is based on country level case data without explicitly correcting for R naught estimate using temporal trends in testing, reporting, and mortality. So we have not corrected for R naught. An international perspective like what we have here can help us understand COVID in a broader context, even though we sacrifice the ability to infer local causalities. At a local level, we sacrifice that, but at a global scale, we're able to inform policies so that in the future, if there's another outbreak, we know why we're doing pandemic preparedness, which is what a lot of countries are doing right now. I know politicians always say it all the time when we have an outbreak like this or a pandemic, and then later on dies. And then when something happens, they get into pandemic preparedness. But we hope that if some of these characteristics are looked into and compared at different countries' level, people can borrow from other countries and try to see how they can adjust that in their own country or look deeply into it. We would like to emphasize that R naught is indicative of eventual outbreak size or the nature. Is not. It doesn't. If you look at, sorry, I mean to say that if you look at our R naught value, a country like South Korea had a high R naught value, but their outbreak size was very low. A country like Australia had a high R naught value, but the outbreak size is not large compared to a country like the US or a country like Brazil. So the point is that R naught, which is the basic reproduction number, which is the number of persons that one infected person can infect in a naive population, in a population that's susceptible, is an indicative of eventual outbreak size or the nature of subsequent waves. So it is not an indicative of that. Factors influencing R naught identified here reflect the naive or intrinsic factors that may determine the country's vulnerability to the novel coronavirus. The values that we have here should serve as a baseline expectation for how fast COVID-19 will spread if interventions were to be prematurely lifted, given that the percent of population susceptible to COVID-19 is still relatively low. But well, at this point, till we have a vaccine. So this is what we did at that first phase. As I will be joining this channel, I will be discussing other work that we're doing from that first phase to the second phase to the third phase, and now where we are in the fourth phase. So we have been doing work informing policies here. I'm part of the Canada Task Force for COVID-19, and we have been doing work at the Field Institute at York University here and informing policies in our country. And we plan to continue our work till we get rid. We are not planning to just control COVID, we're planning to get rid of it, and we'll work day in, day out to ensure that we get rid of COVID. Thank you so much.
Good. Can you hear me?
Yes, I can hear you.
Thanks a lot, Jude. Your talk was so interesting that I had difficulty trying to go around to make sure that everything was okay. All the time I was like so concentrated on what you were saying that it was pretty hard for me to to keep doing something else. First of all, thanks a lot for the nice talk. I'm saying with honesty, all the honesty, I can say that it was pretty interesting. I have some questions. As I told you before, this live will be available. So if anyone make any question, I can send it by mail. You can as well leave your email available. And if I understood properly, you are open for the comeback in the future. So anyway, do you allow me to make some questions? Okay. First of all, Jude, I would like to make you, if I understood properly, the model you presented, the field that you are working right now is more related to the behavior of people. So that's how the behavior of people can affect how the COVID is spread. So your work is not, let's say, concentrated on the let's say, in the minor details. You are more concentrated how the interaction between people. Like as you said, the social media has a negative impact. Then you gave some kind of nice examples. So my question is, recently I have been reading a lot about the concept of bullshit. That I don't know if you bullshit. It's a kind of scientific field. People study how that happens. So do you believe that the negative effect that social media and the spread of COVID has, this negative effect, has to do with this kind of bullshit, people spreading lies and misinformation, and people say whatever they want, confirmation bias from psychology. So this negative, as you said, you are not pretty sure why this negative effect happened, if I understood properly. But do you believe that it has to do with the kind of people telling whatever they want? Do you believe that could be the case?
So what I know, and thank you for that question, George. What I know when it comes to misinformation or disinformation is that people consume negative things very easily. If I were to say something positive here, nobody will want to hear it. The media doesn't follow you to interview you because, no, not all medias, but most of the time when the media will get people to hear things that they want to hear, people go towards that. With COVID-19, people working from home, people tend a lot to be using social media. A lot of people lost their jobs, they were on social media. Because negative information spread really fast, and people have a tendency to consume negative information much more than they consume positive information, they ended up spreading misinformation or disinformation. And why did they spread it? Because it sounds like news to them when you tell them the Gates Foundation did this. This was created. There were already vaccines being produced. Or if COVID cannot attack this group of people. The moment people, tropical climate, this is not really, cannot come to our countries. The moment you spread that particular information, people hear that it's news to them. They send it to the next person. It's news to the next person. He sent it to the next person. And it ended up becoming viral. When it is something positive, people look at it, it's what I hear on the media. It doesn't go out. So COVID-19 spread a lot. Misinformation helped push that. People got misinformation and went on with it, spread it, and others listened to that and believed in it. I listened to a case in Ghana where somebody said, there's a particular tea that if you drink in the morning, you can go on with your life and nothing will happen to you. Those people tend to be the super spreaders. I listened to a case where somebody was talking about a locally made liquor in Cameroon. I would call it kind of like vodka, where if they drink it, you have COVID, it will kill it. Or people listening to Trump when Trump said that if you distill yourself or just put it at a very high temperature, you get rid of this. I learned that when people did go to the shop to buy that distiller to drink, to ensure, and that was going to kill them, to ensure that they get rid of COVID, that if you take that, COVID cannot attack you. Negative information spread really fast. And yes, to go back to your question, the use of social media helped, and it's in agreement with my result, the use of social media helped spread negative information. And that helped ensure that we had a lot of super spreaders. Why? Because when people listen to things like that, they did not believe in COVID anymore. And so they went on their normal activities as if life is normal. When somebody said that chloroquine could be used to cure COVID, people spread that a lot. And in tropical areas, chloroquine was already very common in these areas. And in most places where people can just go to the counter and buy drugs without having a prescription with a doctor, they took that. In Nigeria, people died of chloroquine overdose because they heard that and they thought that was going to prevent them. And when that information moved around, you had a lot of people taking that, self-medicating, taking things like chloroquine and then moving on with their daily life. Those people ended up becoming super spreaders because they felt that they were fortified, they were protected, and that nothing could happen to them. And it's because of social media. But I'm not saying we should block social media. I want to be very clear. We should never block social media, the use of social media. We should always direct it to our own interest. If people are able to spread negative information, we should always find a way to spread positive information. And this will happen if you and I, 1 or 2, 3 persons, start spreading the positive information to counteract the negative information that others are spreading.
But that's interesting what you are saying, because I'm a very curious person. I read a lot. So recently I'm reading a book about bullshit. And the guy said what you said. He said that it's much easier for you to spread false information than to correct the false information. In the case of autism, a scientist in Europe, I don't remember the country, found that there's a correlation between autism and vaccine. And people disprove that a lot. It has been disproved several times, but people still keep believing that vaccine and autism has a correlation. So it's a kind of fake news or bullshit, as they call in the book. So things are good. As you already told me, you have a lot of work to do. I'd like to talk to you about the last point. Since I'm from Brazil, I got pretty interested. If you can maybe come back to that part of your slide that you showed Brazil.
Go on with the question.
You showed me in a slide that kind of growth rate. In Brazil, you have some like South Korea, you have Brazil, then you show like Brazil has a kind of, it was almost like it's exponential. I didn't understand pretty well because there are 2 countries that was different, South Korea and there was Brazil. Brazil was precisely following the curve. In the case of South Korea decided to fall and it decided to go apart. I didn't understand precisely, it was a little bit, I got a little bit lost. What is the difference between Brazil and South Korea, if I understood properly the graph?
So what happened, what I showed earlier on was that South Korea had a higher R0 value compared to Brazil. And that South Korea went up really fast. Then they put in measures immediately and it brought that down. But Brazil did not go up really fast. So, and that's why we're looking at pre-existing country characteristics that may have caused countries like Brazil to start very slowly. But what happened in Brazil will have been on the control measures that were put in place. And I'm not criticizing the president of Brazil. I'm not saying the president of Brazil was against non-pharmaceutical intervention at the start, just like in the US. But when things happen like this, you realize that policies matter. Leadership matter. Policymakers need to be consistent, and leaders of a country need to know that people look up to them and that the statements they make are very important. But I'm not blaming the president of the US, or the previous president of the United States, or the president of Brazil for not supporting policymakers that were telling people to stay at home, that were telling people to social distance. But I'm saying that if they had added their voice strongly, the way they add their voice when they're campaigning, other people will have listened to them. And maybe their cases will have been in South Korea. They will have suppressed it like South Korea immediately. Australia immediately suppressed it and it went down, even though it was going really fast. So Brazil went slowly and stayed on and kept on going. And cases went up. And Brazil is one of the countries where a lot of people have died. May their soul rest in perfect peace. It's a pity that because of politics,
I know. I live here. Anyway, so I not take too much of your time. I just have, since you are like here in a channel about biomathematics and you have a kind of a broad audience, you do not have like a very specific audience. Can you tell a little bit about the difficulties that you face? Because when you make mathematical model to biological system, you may have several difficulties because human is not like machine. Most of the mathematical models were designed for no living matter. They came from physicists, from physics, and so on. When you go to biology to make mathematical model from biological system, it's very complex, it's very dynamic. So most of them have to make approximation, have to make some kind of assumptions. So can you tell me maybe one difficulty, just not to go too much on this topic, one big difficulty that you faced when you were designing this model, or maybe people are facing, maybe, I don't know which you think that would be the case.
Thank you so much, George. I was laughing at my friend yesterday when she sent a post on Twitter saying that I don't know how I get upset more than 1,000 times when my model cannot explain data. When you design model, but the point that every model has why I was laughing at her post, and she laughed at it too, was because she knows you try over and over till you're able to capture reality and inform the public. But one thing I want to say before I move, like Box rightly said, no model is right, but some models are useful. The goal with modeling is always to inform policies. You will never have a perfect model, because when you try to have a perfect model, complexity involved, you will need to inform everything. But you always want to have the basic model that will be able to inform policy, to indicate that this is what can be done. Once you are able to inform policies with that, then at that point you will feel that, well, that is the usefulness of that particular model and the direction let's take it. Where do we get frustrated? Nobody wants to try things over and over. But as modelers, we learn to ensure that we fine-tune our model till we'll have the most efficient model. It could be tiring, but the most motivating thing about modelers is always when you are going to inform policies in your country and save lives. That's the most motivating thing. Here in Canada, I will never get tired. I would rather go without sleeping because you sit and you're working if you know your work is going to inform policies. And that's what we do at York University and with the task force at the Field Institute in Toronto. So we ensure that we do it over and over till we have something. You do it over and over, you stay up, you work hard to ensure that you inform policy, you see what is going to happen. For instance, when we start having a militant strength from UK, you work hard to see the race. What is going to happen? Is this going to dominate? Are we going to have another wave because of this? You work hard and hard, and you come up with results, and then the next day you feel like, oh, I did not take this into account, this assumption. You start again from level 0. Yes, it could be frustrating at times, but you get a lot of motivation when you know that your work is going to inform policies and save lives, because there are families that get up every morning and they cannot see their loved one. And if you can help, just sacrificing a night is enough. It's nothing compared to that family that will not see their loved ones, that will go to bed without seeing their loved one. So there are a lot of motivating things that motivate us as modelers to go on with our work because it informs policies compared to the things that give us stress. So the motivating thing is always what the work is going to do. Informing policies is very important.
So thanks a lot, Jude, for the talk. Thanks a lot for all the knowledge. I mean, this video will be available on the channel later. People can. I make sure, if you allow me, to leave your email on the description of the video, to leave any kind of link that they can find your social network, they can find your work. So thank you a lot for accept. Do you want to say anything else, or I think that you want to add something to finish the live, or that's all?
No, I'm open to any question from the public or any question that you may have to ask, if you still have any. So long as we're able to use our work, we get funding from the public. And the public that may have gotten me to this level. Without the public support, I would not be able to do the work I do. Basically went to school in public money. And so I want to thank the public for that. And at any one point, despite being a human and trying to ensure that I do my work to inform policies, I always want to get back to the public and know that the public educated me, they sponsor my work to get to where I am. And so my work needs to go back to serve my community, to serve my country. That's the reason why they do this.
Me too. I share the same as you. I also studied all of my life in a public school. My PhD was paid by public money, so I feel as an obligation to somehow to give that back somehow. Of course, I have to eat, but anyway. But whenever I can, for example, this channel is I'm not getting paid for that, so I just try to help to disseminate, to help biomathematics. And as you told you are open for more questions. Unfortunately, I mean, the audience didn't come. I mean, it will be available. It will be available on YouTube. My experience that people access later, because anyway, people has a lot of things to do as well. So, and the audience as well is very closed. I mean, you are looking for people that work biomathematics. So if you allow me to make one question, I was curious about the case of New Zealand, because you showed me on a mathematical model that the social behavior of people, says how the country responded to the COVID it has a different impact on your model. I didn't see the case of New Zealand. New Zealand seemed that they had a very good close down of the country. They were pretty fast. As soon as the COVID started, they create a kind of lockdown.
Yeah, and I mentioned that I was showing just 8 cases because we had the graph for the entire world. I could not show all the graphs for the entire world in those slides, right? So I only pick 8 slides, just the first 8 in alphabetical order. I didn't really even take a look at which country I'm picking. I just went to the graphs when I was putting those slides and picked the first 8. Yes, we did measure the R0 value for New Zealand, and we'll do a lot of studies on them. And again, I want to repeat that the work I shared today is just the first phase, just before the lockdowns were effective, before middle March. And then after, we look at what happened between January and March. Other work, we are looking at different time points.
Okay, very interesting. I did live on this channel. I did a live myself about system thinking that has to do with system biology, because in system biology, as you know, we did system biology by the same professor. How the part Professor Armando is here. Let me see if Professor Armando. Do you mind if Professor Armando come here if he wants to talk to us? He worked with COVID. Do you think it's a problem if I invite him?
No,
Let me send him the invitation. He's thanking he must leave. He's thanking for the talk. Let me see if he want to ask a question. If he want to ask a question. He's thanking for the talk and he is leaving. Professor Armando, he'll give the talk as well in the future on this channel. He's going to talk as well about the COVID. Let me send him the link. He said he has to leave, but let's see if he has a time to ask a question. Let's see if I can. Anyway, let me see. I send him the link if he can join us. He said he has to leave. And he asked you, thank you for the talk. Like, it was a pretty nice talk. I told him about your work, and he was quite interested. He told me he would like to know you, to meet you, but anyway, I think he had left. He had to leave. Anyway, let's see. If you decide to enter, you can go on. So as I was asking you, the system thinking that you learned for system biology, it was about how the part connect. Since we are talking about social modeling, you are quite concerned about how people interact with each other. So did you find, because as you know from gene expression, that the molecular biology was able to understand how each gene works individually. If you take the amount of gene for rice has much more gene than human, but human is more complex than rice. And the rats has more or less the same amount of gene. So it has the effect that the amount of gene is not enough to explain the complexity of living system. So in the case of this model that you did of social behavior, did you find any behavior that you believe that is specific from this kind of interaction? I mean, that you cannot explain specifically by studying each human. I mean, you take one human, but when you put them together, you create emergent property, which is I think of system biology. Did you find anything related to system biology in your research?
No, we didn't look at the psychological aspect of human beings. We only we don't get into people's psychology. We looked at, motivational factors. People would change their behavior based on different dynamics. It could be incentives from the government. We just integrated that into the model. We do not get into each individual and distinguish them, because if you get into the genome of each individual, then you treat each individual as an agent, because people have different dynamics. So we didn't take into account that. We just assumed that the general behavior, homogeneously, people could behave this way based on whatever is happening around their environment. So in most of my work, that's what we looked at. We do not get right into the system biology aspect of it.
Okay, interesting. I was curious about that because I did a lot about system thinking, and I was talking about how the system biology or system pharmacology, system biomedicine, or any kind of system thinking, how this can be very important when you do medical model. Because you cannot just take one part and say, if I start this part, it will work. No, you need to take into account how this part interacts together as well, because as you said, I believe that you took into account system thinking, but because you said that the different country, different behavior, you said about the GPI, I believe you said about social media, so you show that change from country to country. So I believe that's system thinking, because how each country interacts with each other. So for them, in the case of, I think it was not Scotland, it was New Zealand, that they decide to do whatever they want. They decide to, I don't care. Brazil decided the same path as well. Other countries, such as New Zealand, decided to close down. So the behavior of each person of the country had a big influence how you showed your model, how your model gave the result. I believe that's kind of system thinking.
Oh, okay. I haven't done a lot about that yet, but it depends on your definition of system thinking. That could be it. When you talk about system thinking, I was thinking about getting somebody's neural system and thinking of an individual, what would drive your decisions. And to me, that's completely different from, because individual behavior, we're looking at a general population level behavior and not individual. We're not treating the population as an agent. Each individual in the population as an agent. We're treating the overall population as a whole.
Well, I believe that's at least how I see it, the way I see system thinking. That's the best system thinking, because I'm not concerned about the individual element. You are concerned about how they interact with each other, how the emergent property, how the big system work. That my interpretation, that's system thinking.
Okay, that's good.
Okay, so thanks a lot, Jude. So you are invited to come back in the future, as you said that you are interested to come back. You are invited wherever you want.
Thank you.
I'm pretty sure that this talk of yours will be available here. People will start to see. It's extremely valuable to the channel.
Thank you so much, and thank you for inviting me here. I'm looking forward to the future talk.
Okay, and think of your friend as well for the networking of your.
Thanks a lot.
Of your friend. So see you.